It wasn't until I started looking at laboratories outside the United States, smaller laboratories that were doing amazing work, listening to the course of legitimate patients for whom not only did marijuana work, it was the only thing that worked. And that was quite stunning to me. I also looked closely at the DEA scheduling policy. They classify marijuana as a Schedule I substance, saying it's in the category of the most dangerous substances out there. And when I looked carefully at that, I found there was really no scientific evidence to say it was that dangerous, that it had high abuse potential, and that it had no medical applications.
As you can see, even well-respected members of society, including medical professionals, have been left dumbfounded as to why marijuana is not legalized for medicinal purposes. Rather, it is classified as a Schedule I drug, the same schedule as heroin and LSD, and a schedule above methamphetamine. The classification of Schedule I means that the drug has no accepted medical use and is considered to be among the most dangerous drugs. As evidenced by Dr. Sanjay Gupta, there are many individuals who are able to benefit when treated by medical marijuana.
Charlotte Fiji, a young girl who had a severe form of epilepsy called Dravet syndrome, was suffering from 300 seizures a week. The seizures were preventing her growth and development. She was near death at the age of 5. After trying a multitude of medications, her parents decided to try medical marijuana for their child. A group of brothers began to create a hybrid form of marijuana with a high CBD level, which has the healing qualities, and an almost non-existent THC level, which is the source of the psychoactive effects of marijuana. Within weeks, she went from having 300 seizures a week to only 3. She has also began to develop at a normal pace after cannabis oil was introduced to her as medication.
Additionally, Michaela Comstock was diagnosed at age 7 with leukemia that had reached her brain and her spinal fluids. Her parents knew immediately that they wanted to try using medical marijuana as an alternative treatment. They had heard from many sources the healing properties that accompany medical use. Within hours of the first use, the crippling effects of chemotherapy began to disappear. After a few months, her cancer began to go into remission, which amazed her parents and doctors alike.
Marijuana has been shown to treat a variety of diseases and disorders. A close friend of mine suffers from ankylosing spondylitis, a long-term arthritis that causes the bones and joints in her body to fuse together. She has also noticed other improvements in her daily life because of the use of marijuana.
I have this condition called ankylosing spondylitis, or AS for short, and when I smoke, I notice that none of my joints hurt. Like, what my condition does is it affects my spine, but it also affects every bone in my body and every joint. So if I smoke, I don't feel the pain from my joints. If it were legalized, we could make a lot of money off of it through regulation. Like, it's not something that should just be rampantly legal. It should be regulated. I feel like taxing it would help our debt situation. And medicinal use of cannabis is also something really to look into, because I know it's helped me and it can help a lot of different people. Any substance, people are going to abuse it, but I feel with regulation that could be helped. Like, I mean, take alcohol, for example. I feel happier. I feel more relaxed. Like, honestly, I can focus more on the matters at hand. I'm also less anxious, and any, like, you know how you get down in the blues, everybody has it. It happens less often now. Marijuana also helps with my appetite, because the medication I'm on for my condition, it makes me not want to eat anything. And I had been losing weight before this, and now I feel healthy.